There are more than 20 peer-reviewed published studies documenting the fact that in about 15% of melanocytic neoplasms, diagnosis by histopathology produces uncertain or controversial results. So when there is a significant level of uncertainty or a reasonable possibility that a colleague could examine the same case and arrive at a very different diagnosis, it makes sense to consider some form of diagnostic support, whether that's in the form of expert consultation, discussion with the clinician, or an ancillary molecular test. It's probably simpler to define situations in which ancillary tests should not be used. If you're certain in the diagnosis of benign nevus or malignant melanoma, don't order the test. It doesn't make any sense. In other words, if you are so confident in your diagnosis that you would probably be willing to dismiss an ancillary test result that disagreed with that diagnosis, don't order the test. It's not worthwhile in that circumstance. But ultimately, using these ancillary diagnostic tests for melanoma is no different than using any other medical test. The same principles apply, and most of us were taught in medical school that before you order any test, carefully consider all of the possible results that that test can produce and what you would do with each of them. And if an ancillary test result could potentially change your report or change the way that a patient is counseled or treated, then it's probably worth considering.